Hello, my name is Lex Landreneau, and today I'll be presenting a psychological case analysis of the film Vertigo by Alfred Hitchcock. The character that I'll be discussing today is John Scotty Ferguson. He's the protagonist of this film, and after a traumatic experience where he's dangling from this rooftop, right, he develops an extreme fear of heights. While acting as a private investigator throughout the rest of the film, he's brought face to face with this disorder. The film is set in 1950s America, a time where mental health care is less accessible, and it perhaps carries a social stigma, right, where men like Scotty are expected to be stoic and unaffected by this disorder. So the disorder presented in this film is a specific phobia. The term for the fear of heights that Scotty has is acrophobia. A specific phobia is an irrational fear triggered by a particular item or situation that interferes with normal daily living. As stated, Scotty expresses acrophobia, which is a fear of heights. Phobias were recognized as a medical issue in the historical period of this film. Although some in the 1950s might see this condition as a personal weakness, it seems that Scotty has received medical help for this condition. Phobias are recognized by most cultures because a fear, like a fear of heights, is reasonable. It's a natural fear. However, different cultures likely approach acrophobia in different ways. In the West, phobias are thought of as a medical issue and a rational fear, but in other cultures, they might be viewed as an imbalance of energies or attributed to spiritual causes. A phobia, like the fear of heights expressed by Scotty, may be heavily stigmatized, right? And it is during this film. At one point in the film, his acrophobia interferes with his ability to save a woman from falling out of a tower. And for this, Scotty is heavily criticized. In this manner, a phobia stigmatizes, it questions the abilities and courage of the affected individual. So there are some symptoms that Scotty displays throughout this film. Firstly, he expresses an immediate anxiety in response to heights. This culminates in him experiencing extreme vertigo, a physical symptom. This anxiety gets in the way of his own actions, right? As previously stated, there's this opportunity for him to save this woman from falling out of a tower, but he's unable to due to his own fear of heights and the anxiety that he feels. In addition to this, Scotty actively avoids heights. In fact, he likely resigns from his job as a detective to ensure that he doesn't have to come in contact with heights again. This symptom, called avoidance, gets in the way of a person's living because this fear changes the way that they make decisions. However, there's a symptom that is not displayed that is characteristic of a specific phobia, which is an admission of the fear's irrationality. Scotty doesn't really ever recognize that this fear is excessive or unreasonable. As for treatment, the best treatment for Scotty would be exposure therapy, the gold standard for treating specific phobias. This would involve gradually exposing him to heights in order to reduce his response, reduce the anxiety that he feels whenever he is exposed to heights. The ethical concern here is that he has to consent to this. If the patient feels pressured into exposure therapy, that could be seen as unethical, as you're putting this patient into this very, very distressing situation given their phobia. In Scotty's case, societal attitudes towards therapy may be a barrier to him receiving treatment. He might not want to be seen as a person who undergoes this type of work, or it might not just be accepted by him given how uncommon it might be seen. So the broader perspective here is that Vertigo portrays this disorder in a respectful manner. Scotty is displayed as a victim of circumstance, and his condition is not mocked during the film. This seems to be an accurate depiction of a disorder, as all of the most common symptoms were exhibited by Scotty. Films like this can reflect and shape the attitudes that we have towards certain diseases. And this film paints specific phobia as a debilitating and tragic disorder. Scotty's unable to do what he wants to do on account of this phobia, and that troubles him deeply. So this likely increases awareness and acceptance of the ailment. However, the disorder is probably dramatized for effect during the film. Thank you for listening to my analysis of Vertigo that faithfully presents a specific phobia through this story of Scotty Ferguson.